Hello and welcome. I hope that you all are having a fantastic week. I am going to be talking with you guys this week a little bit about chapter 2 from the textbook. So, this has to do with the biological development in infancy and childhood. So, we're going to be talking a lot about prenatal care, everything from birth, and in the womb, um, to biological implications in the first few years of a baby's life. So it's we're going to talk a lot about, and you're going to read about in the book, the dynamics of human reproduction, um, prenatal influences. It talks a lot in the book about different prenatal influences, as well as drug abuse and when a baby is in the womb. And so this is something that would be very important for you to know about. For example, if you are working with CPS and you have a baby that was born with drugs in their system. So these are, lots of important different things to know about, different prenatal assessments, different problems that women could have during pregnancy, and then the actual birth process, which can be fairly traumatic for both women and a baby sometimes. So, human reproduction, we all know, a sperm meets the egg and a child is conceived, but it's not quite that simple, obviously, in real life. The average pregnancy lasts 266 days. It's also usually about 9 months or about 40 weeks. And so, if you have a baby that is born early, earlier than 40 weeks, depending on the size of the baby and how far along they are. Usually, anything born earlier than 36 weeks is usually considered a premature preemie baby. So there's certain things to look for as infants grow and develop, and there's usually some patterns and some things to look for. The textbook will talk a lot about some of these patterns that you'll look for. It also talks about the nature versus nurture controversy, which is very interesting to think about. And nature definitely plays a huge role in a child's predisposition as well. So the textbook will talk to you about normal developmental milestones for all of these different ages: 4 months, 8 months, 1 year, 18 months. It'll look at the motor skills and normal development in terms of motor skills, adaptive, social, and language. So, if you, for example, are working with a family and they have a 1 year old who isn't even crawling yet, right? So around 12 months to 16 months or so is when children usually start walking. And so if they have a child who hasn't started crawling yet, then it might be, time for a referral or a recommendation to talk to their pediatrician further about that. So it's important for us to know about these developmental milestones when we're working with some of our families. So then the textbook also goes into a lot of detail about the abortion controversy. And so, really educating you about the whole controversy. I think it's very important to think about it again from a perspective of if you're working in the field and you're working at a high school and you have a teen who is pregnant. So, really making sure that you are educated enough to be able to talk with that teen about lots of their different options and recognizing and understanding that your values, right, your personal values versus the profession's values may differ a little bit in this area. And so, how can you kind of reconcile some of those two differences? The textbook goes into more detail about reasons for abortion, methods of abortion, timing, right? It's a very safe practice in the United States, but the further a woman is into her pregnancy, the greatest risk that she is at. So it's definitely important to keep the timing of everything in mind. The textbook goes more into detail about arguments that are typically made for and against abortion. Um, so again, we want you to be able to have a lot of information and a lot of knowledge about this issue. Social workers specifically have a very important role in the issue of abortion because we oftentimes are educators and brokers and advocates for individuals. The textbook goes into quite a bit of detail about different ethical dilemmas as well that you may encounter with abortion. So then finally, the textbook wraps up with the issue of infertility. And so it talks a lot about different causes of infertility that people might have, psychological reactions to different to infertility. A lot of people may experience grief and loss and depression because of that. And so there's a lot of different psychological reactions that happen to both males and females regarding infertility. And so the textbook then again goes into talking with you about different treatments for infertility, assessment of infertility, alternatives, as well as what roles a social worker might play in working with someone who's experiencing infertility, particularly empowerment and approaching it from an empowerment perspective. So that's a little overview of chapter 2. I hope you guys have a great week. And if there's anything that you need, please don't hesitate to reach out. And I look forward to talking with you soon. Thanks so much.